I must say that we are so delighted to be here today with the Global Health Exchange. As you said, I'm an Irish citizen. I'm with my colleague, Leonie, the director of the Ifrah Foundation. I set up Ifrah Foundation online before actually it was a charity and a registered charity. And the reason being was in Ireland, first time when I started the campaign, there was a lot of young women. We had the United Youth of Ireland, but the United Youth of Ireland was a lot of people, different nationalities, and many of the women who needed help, they say, we want to speak with Ifrah. And then we say, how can we actually make sure that those women trust the United Youth of Ireland and they are speaking to me? So I sit with the young people from different nationalities and we say, what is the best way to actually have those women support? And the women we help, they were not only Irish women who had a problem with medical, but women around European countries who were facing difficult when they go to hospital or when they were pregnant and explain to the nurse or the hospitals that they were pregnant. So we said we're going to set up Ifrah Foundation online and then they can directly Facebook me or send me message if they want to. Then we set up Ifrah Foundation online and I was actually talking to women through on social media, and that's how I started on Ifrah Foundation. But luckily, I meet with Sammy Leslie. Some of you may know is owner of the Castle Leslie. When I met with her, she asked me on a question about if I belong to any organization or how does my work actually document it. I told her that I was doing through United Youth of Ireland, but we have Ifrah Foundation online, and Sammy Leslie actually came up with a really good idea of setting up Ifrah Foundation as a charity in 2010. And we luckily became a charity in Ireland and Somalia as well. But for me, taking my global campaign to Somalia is 2013 when I get my Irish passport. I decided if I had a voice in Ireland, I could have voice in Somalia. And I became actually European activist in terms of being a champion in Ireland, because in 2012, Ireland has legislated on female genital mutilation, and I was one of the main characters who've been active on public speech and, you know, taking the issue on my own hand as a survivor of female genital mutilation. So we're so lucky to have Ifrah Foundation, and now Ifrah Foundation actually we take back to Somalia, and I'm doing a lot of work with UN agencies back in Somalia, and we know Ireland has been giving really genuine support in development countries. Ireland has not gone to Somalia yet, but we hope Ireland will go to Somalia. But we have a really good relationship with Irish Embassy in Nairobi, and also we just had a high-level meeting with the Ireland United Nations representative in New York. And the reason being is that I'm Irish, and I wanted Ireland to see my campaign globally, and that is the reason, basically, those Ireland is supporting us indirectly, not through Irish Aid, and we hope Irish Aid will get directly with the Ifrah Foundation, because Ireland is giving a lot of funding to UNFPA and other organizations. If I remember when we talk about health and the issue that women in conflict countries. And for me, the reason I decided to go back to Somalia is that when I see a lot of young women has been suffering on female genital mutilation and bleeding and all that, I went 2013 back in Somalia, and when I went back to Somalia, I spent 20 days in IDP centers, seeing a lot of young women who've been cut, who've been bleeding, and I see a lot of young women who've been raped and who've been subjected in child marriage. So I said I had a voice in Ireland, I have to take it back to Somalia. I came back to Ireland and I decided to move back without knowing where I will start it. But I was so lucky, as you mentioned, you mentioned one of my dearest friends who'd been killed in July 24th, who brought me to Somalia and started a new life. He introduced me Minister of Gender for Somali federal government. I became an advisor to the minister, and my goal was how can I be inside there so I can help women in Somalia. So through the minister, I started the campaign and also introducing how important it is Somalia to have a child rights convention, to have a gender rights, and to have a female genital mutilation policy, and also sexual offense bill, which is already, it's almost still debating in federal level. And I was lucky, actually, Minister, to see why did I take it, this is my own hand and speaking out on all this women's issue. And the good thing was that Minister, actually, she became active and she was actually doing the work, and I was so happy. And we had the child right policy was passed, and we had gender right was passed, and then we had female genital mutilation policy was developed, and then we had a Human Rights Commission independent was already passed in the parliament. And then we have the sexual offense bill. But all that, it doesn't help because Somalia has been war over 30 years now. But seeing women who have faced in fistula, who have faced a lot of different health consequences in terms of, a child marriage who've been dying for bleeding, and then female genital mutilation who is there, and young girls who've been cut and they bleeding for that. So for me, as a young activist, being in Somalia is to make sure those young girls who are at risk on female genital mutilation not be cut. So in Somalia, what I was doing is that going to village and raising awareness through Ifrah Foundation and working with the international NGOs like UNICEF, UNFPA, UNDP, and Save the Children, actually providing support for us to work in Somalia. Really, last year, the saddest part was we were having activities on religious leaders media campaign, and what happened was a young girl actually died for bleeding, and the young girl died in a village outside Mogadishu, and it's actually, I have to flew there, but I have to take the risk because there is a Al-Shabaab ruled area. And I felt that as an activist, I cannot fail if I don't go to the village and know why the girl has died and how the family, they didn't actually help her to save the girl. So soon after I finished the training, I actually flew to the village. I went to the family, but the saddest part was a family, when they talk about medical and health, the area they live in, rural area, there is no hospital. There is no medical support, and the family have to watch the young girls to death for bleeding 2 hours in about 5 hours. After they seen the young girls was bleeding and bleeding and bleeding, that is when they decide to take her maybe 47 kilometers outside where they were. But imagine the road where it's all broken, and then taking public transport where it actually takes, like, for example, if I travel my own car, it's 1 hour. But if I take a public transport, it's more than 2-3 hours because the car stops. And the young girls was keep bleeding until she goes to the hospital. So I remember visiting the hospital where Derka died, and Derka basically was not only a Somali issue, but it became a global issue because it was actually spoke out globally, and it became an international issue. So when I went to the hospital, I was speaking to the women who actually hold the Derka's case on her hand, and I remember speaking to her and asking how the father felt. And a man from village, when she asked if she could actually donate blood, his own child, he couldn't say yes or he couldn't say no. And this is also part of, non-educational, because his daughter is dying because if maybe he give her the blood, she might be safe, she might be alive today. But he couldn't say yes, he couldn't say no. I tried to speak with the father, but it wasn't possible to speak. I speak to the dad because he wasn't willing to talk. But again, going back to the village and speaking to the mother, and who are saying, yes, she died, but I still will to do my other young girls if she born or if I have a young daughter. That is, is education. And again, talking about in IDBs within Mogadishu, that's where I was born and I was raised. Going back to the IDBs, where many young women actually are suffering with a lot of different health consequences in terms of fistula. I remember one mother was telling me about her young daughter. She was pregnant, 15 years old, who married to a 50-year-old man, and she was actually trying to give birth, but she couldn't, and she bled to death. But the mother told me she watched her own daughter, a baby, to die inside the mother. And that made me really more upset because Actually, people in village, they carry knife. I presume that if they cut the mother's belly, they could remove the child and save the child. But the problem is that there is no education, there is no healthy prevention. So that is how mother is lost, and then the child is lost. I risk myself because I feel that if I am in Somalia, if I save one girl's life, I saved more than enough. So only last year, we lost 7 girls, including Dhaka. But we saved 20 young girls for bleeding because we've been in all over national TV speaking out on the death of the girl and medical consequence and the health issues. So we were so lucky actually to save 20 girls who were cut in different villages and making for hospital facilities, talking to the general DJs in different hospitals and asking them if they could help and make the girls safe. So we did all that work, but as we all know, United Nations resolution on female genital mutilation is 2030 to end the FGM. But if we take that, how will we end it on female genital mutilation if there is no commitment in the global leaders, if there is no commitment on the country that actually young girls are dying? If we look at Somalia, globally, is 2 million women and girls are actually globally affected on FGM, and 3 million are at risk. And then also 800,000 girls are actually cut. And then again, Somalia is a 98% on FGM is practiced. Imagine every girl in a school, she being cut. And imagine every girl in a school, country, there is no health center, or there is no health support, who actually are dying for bleeding and who are dying because they need to be supported in health-wise. So for us as the Ifrah Foundation, our mission statement is 2030 FGM to end. But how will we end it if we don't have the global leaders? In last year, I was given People of the Year award. I was live on national TV, and the Prime Minister was there. And always, I believe Ireland has the heart of the commitment of a global support. And Ireland is a country, genuinely, if we talk about a global, how the aid works, Ireland is the only country that goes in the country and helps in terms of the real support of the humanitarians. And I believe Ireland, if they take the lead of the female genital mutilation, we will end 2030 in globally on FGM. Because Ireland is the only country that I know. I have been worked with a lot of different humanitarian countries where I worked on gender equalities and gender rights and the female genital mutilation. But I believe if Ireland takes this on their hand, we can end this in global, because Ireland is a genuine country that actually supports on female, supports global issues. For us as the Ifrah Foundation, we have a national action plan we actually developed. And the reason we developed is that we went to the community and we asked what the best way of ending FGM in terms of health, in terms of rights, in terms of ending on female genital mutilation. And we developed a national action plan where we actually say that this is how we can implement it on FGM in 2030. But it needs a lot of commitment, actually. The health issue we know on female genital mutilation, the issue of health. Kidney failure, birth, or childbirth, different diseases, emotional, physical, a lot of different things. I can say that in Ireland, when I first came to Ireland as a refugee, I faced one of those, but I didn't get the support I need. And that is one thing lead me to become an activist and being the voice, not the victim. Because I find it that in Ireland, a lot of nurses, they didn't know on female genital mutilation. But I asked other refugee women who I was living in same center, did they have the same experience as me? But when every young woman told me, yes, and we all cried and shared our experience, then I said, we're not going to be silent. I will be speaking out. And that is why today I become the voice, because I think it was very important that the nurses and doctors and everyone to know that we didn't get injured, but we were actually cut, and this is a cultural practice. So that's how I started in Ireland, because the reason was my personal health check. That what led me to become the voice, because the health problem was one of the big issues that in Ireland, that when I went to hospital, I was asked, how did you get injured in your private area? What happened to you? Why? Who did to you this? And then I see a lot of women in the community who've been facing a lot of health consequences. So that's our goal is to affix a bill in Somalia, because I believe if Ireland has legislated FGM, while I wasn't even speaking English and being the voice, and then we had a bill, I can do the same in Somalia. It's really a challenge because we have, every time we join the government, and then we have a political crisis. And then also we have a media and awareness with the religious leaders, which I believe that religious leaders are the main goal to end the FGM if we wanted to be friends with them. Community education is one of the main key, also educating the community in terms of the health and in terms of, the consequence of female genital mutilation. So that's what we do. Our national action plan, we want to actually implement it in 2020, and we hope to work with other organizations. And this is, World Bank actually promised that they will support, but still there's a long way to go, because the federal government of Somalia should adopt this, shouldn't be us, because this is the young women in Somalia that we are protecting, and they're the people who should take in their own hand. But World Bank promised they will actually support if the Somali government take this. But we have a crisis in Somalia, and it's not easy. But that doesn't actually discourage me to say I'm not going to do this work, because still there are many young women who are facing on the consequence of female genital mutilation, that and all others. And there's something we can do. And I'm lucky, because I always say I'm Irish citizen, and that's what makes me to courage and take me back to Somalia. And if there's anything, I say I'm Irish, I'm going back home if there's anything happening. And then most annoying part is that when I work with all other European embassy in Mogadishu, they say, you the only Irish woman in this country, and you are the hardest person who works really actively in the community and do a lot of work, because we've saved a lot of young girls who've been brought back to Somalia as a child marriage and female genital mutilation. Recently, I helped young women from Birmingham who was brought to Somalia on female genital mutilation and child marriage. But I was so lucky, because I have a very good relation with European and back in Somalia. And the girl, within days, she had her passport married, because her family took the passport back, and then she had nothing. But I was working with the Westland police, and then we get a passport, find it from the EU in Somalia, and the young woman was brought it back to Europe, actually, where she belongs. And she was born in Europe, and she doesn't deserve to go through on female genital mutilation. She doesn't deserve to go through on forced marriage. She born in a country where freely she can do what she wants. So this is the kind of work I'm doing in Somalia, though even I'm risking my life, but I believe that if I can do one thing and that helps with young women, I will keep it doing. You can follow us on our Facebook, our Twitter, and thank you so much. And I'm so delighted, basically, to be on part of this global health exchange, because it's very important for me in Ireland when we talk about health, female genital mutilation, and Somalia also, because these are my adopted country, and I am sure that my adopted country can do a lot in Somalia. Thank you so much.